Hello everyone, my name is T.M. Rani. I am a senior clinical applications specialist with Philips Ultrasound for general imaging. Today I'm going to talk about the advantages of multimodality fusion imaging with real-time ultrasound in liver applications. These are the main objectives of this presentation. In this presentation, we will see how we can combine the multimodalities to leverage the strength of CT or MR with real-time ultrasound for more confident diagnosis. This presentation will give you an overview of Philips auto-registration technique that brings new levels of simplicity to abdomen image fusion. And then we will see the benefits of fusion imaging using ultrasound. These are a couple of press releases that were published few years back indicating the risk of cancer due to the radiation from CT scans. There were few studies that were performed in United Kingdom and Australia that indicates there is an increase in cases of cancer among the children and young adults who had undergone CT examinations. This is a press release regarding the possible risk of MR contrast exams. This study has confirmed the deposition of gadolinium in brain and bone of patients who had undergone multiple MR contrast examinations. There is certainly a growing awareness, and the number of CT procedures performed on children has declined in the recent years. For certain clinical exams, we can avoid the repeat CT or MR scans, and we can take the advantage of fusion imaging. What is fusion? Fusion is a technique where we combine multimodalities like CT or MR or PET-CT with real-time ultrasound. Why we need fusion? Many times we come across lesions that are not visible on every imaging modalities. Sometimes you can see the lesion on CT, but you can't find it on ultrasound. So combining these two imaging modalities can empower the clinicians to find these lesions faster on ultrasound. Ultrasound is also safe, cost effective, and most important, it is comfortable for patients. You can also use contrast enhanced ultrasound in combination with fusion. The main advantage is by using fusion imaging, we can identify the exact location of the lesion on ultrasound before we inject the contrast media. When we are looking at liver lesions, this can be very helpful to capture the arterial phase because the arterial phase will start at around 10 seconds after the contrast injection. And if you know the exact location of the lesion, then you are able to capture the arterial phase, and this can help in more confident diagnosis. Another benefit is comparing the images from different time point. Maybe the patient has undergone the CT exam last year and today you want to monitor the disease state. With fusion imaging, you can fuse the historic CT images with real-time ultrasound, and this can positively influence the treatment pathways without exposing patient to a repeat CT exam. So fusion can help to expand the role of ultrasound imaging. Fusion imaging benefits are based on the ability to bring together the advantages of various imaging modalities that can help to provide best possible outcome for the patients. But registration of two imaging modalities can be time consuming and technically challenging. It can take up to 10 minutes to achieve successful fusion with conventional registration techniques. Philips' anatomical intelligence for ultrasound allows image fusion with auto-registration to provide successful alignment of CT and MR volumes to ultrasound in 1 minute. Philips auto-registration uses either lever vessels or lever surface-based technique to perform automated fusion. The automatic CT ultrasound lever vessel registration first extracts the 3D vessel trees of the entire lever from the contrast CT data. Then an ultrasound sweep of the lever is acquired such that some lever vessels are captured in the sweep. The registration algorithm then finds the best fit to align the 3D vessel tree within the lever CT volume and the 3D vessel tree acquired within the ultrasound sweep volume. Just to draw an analogy, it is like a fingerprint matching technique. The lever surface registration first extracts the 3D surface of the lever from the non-contrast CT data. Then an ultrasound sweep of the lever is acquired such that part of the lever diaphragm is captured in the sweep. The registration algorithm then finds the best way to align the 3D surface from the CT volume with the lever diaphragm from the ultrasound sweep volume. This is similar to face recognition technique. After we achieve the fusion, if required, you can also reposition the patient without losing the fusion. This is possible because of active patient tracking. Philips auto registration is very simple, fast, efficient, and robust technique for abdomen fusion. Fusion and navigation plays an important role in interventional radiology. Percutaneous treatment of liver tumors using microwave or radiofrequency ablation requires precise needle placement for effective therapy. Many times, CT is not always available for guidance of liver ablation. Some liver lesions can be difficult to see with ultrasound and CT. Also, CT can limit the operator's angle or approach during the interventional procedure. In these scenarios, multimodality image fusion with ultrasound for percutaneous liver tumor therapy can expand the number of cases that can be treated with ultrasound. This is a paper that is published by Department of Radiology of Mount Sinai Medical Center in New York. This paper talks about the advantages of needle navigation in CT-guided liver biopsies. The figure 3 and figure 7 indicates that by using needle navigation assistant, there is a great potential to decrease the number of intra-procedural CT scans and the needle path manipulation. This can help to reduce effective radiation dose to the patient during CT-guided liver biopsy procedures. The another feature I would like to mention is tumor contour. This is a semi-automated tool that helps to outline a 3D contour around a structure of interest. This helps to improve procedure guidance in challenging cases where the liver lesions may not be clearly visible under ultrasound. For ablation procedures, you can use tumor contour for trajectory planning. It is possible to draw and display the safety margin to highlight additional healthy tissue that needs to be ablated around the cancerous lesion. You can also calculate the ablation coverage and the residual tissue. The MC72 microconvex transducer is designed for ultrasound procedure guidance. This transducer has excellent ergonomics with small footprint and is specially designed for intercostal imaging. This transducer is ideal for abdominal and interventional procedures. It has integrated electromagnetic tracker that provides an ergonomic solution for fusion and navigation. The MC72 superb imaging qualities are complemented with contrast enhanced ultrasound capabilities and microflow imaging. This transducer is also compatible with Sivco Versa biopsy guide. You can attach this guide directly on transducer without an external bracket. And this helps to reduce the blind zone during the needle guidance. These are the images of MC72. As you can see, you get excellent spatial and contrast resolution with this transducer. It also gives nice image penetration and uniform resolution from near field to the far field. For advanced needle navigation, we have reusable adaptive needle tracker. It is a hub tracking solution and is compatible with biopsy and ablation devices from 10 to 18 gauge. You can use ANT for ablation procedure and for superficial lesion biopsies. On Epic Elite, we also have Sivco E-Track needle tip tracking. E-Track comes with reusable sensor that provides electromagnetic tracking with specialized single-use silicone needles. The sensor is inserted into the disposable E-track needles. The E-track can be used for small or deep lesion biopsies where you need more precision. It is available in four sizes: 12, 14, 16, and 18 gauge. Now let's see the demonstration of fusion imaging.
This demonstration, I am using the historic abdominal CT contrast data and will use auto-registration with vessel-based technique. For abdominal fusion, the patient is positioned in supine position, the way the historic scan was acquired. Then place the patient tracker on the stable position like patient sternum or ribs close to the region of interest. For this demo, I'm going to use this abdominal phantom and I will place the patient tracker on the phantom. Load the CT dataset by either using CD, DVD, USB, or you can query retrieve it directly from PACS. We usually use axial CT data with slice thickness, preferably less than 3 millimeters. Perkinav also supports non-axial datasets, that is coronal and sagittal planes. Select the C92 transducer and abdomen general preset. Place the transducer bracket on C92 and mount the transducer tracker. This tracker that I am using is universal and is also compatible with C51, X61, S51 and L12-5 transducers. Position the field generator to the appropriate position for the procedure. Select the CT data from review and then select fusion. Select the registration method and then select auto registration from the drop-down menu. You can select vessel-based or surface-based method depending on the image series loaded into the Perkinav. Vessel-based works best with contrast CT that are venous, portal, hepatic, and potentially late phase. For MR dataset, vessel-based works best with the T1 series. Scan the right liver lobe and acquire a manual sweep. The best window for acquisition is intercostal oblique. Instruct the patient to pause breathing during the sweep acquisition. Remember, patients should not hold their breath on deep inhalation or expiration. Touch the middle trackball button to start the freehand sweep. Try to capture the portal venous confluence vessels during the sweep. Touch the middle trackball button to stop the acquisition. Patient can then resume breathing. Click on registration to complete the fusion of CT with real-time ultrasound. During the sweep acquisition, ensure good electromagnetic tracking of the transducer and patient tracker. If the tracking is lost during part of the sweep, any vessel tree from the sweep could be compromised, resulting in poor registration. System also displays the 3D view to assess vessel segmentation. The green lines are the segmentation from ultrasound, while the red lines are segmentation from CT. Scan different planes to verify accuracy of image fusion, focusing on the area of interest. If you are satisfied with the fusion accuracy, then you can even save this registration. In case, if you want to make fine adjustment to the fusion, then you can use the following controls, that is point-to-point, transducer, or trackball. After making these adjustments, if you are not satisfied with the accuracy of fusion, then you can reload the saved registration. This will reset all the fusion adjustments that you have done. You can set the target in CT image where the suspect lesion is most probably seen. Once you set the target, the ultrasound guidance bar will appear on the screen. If the guidance bar is yellow or blue, that indicates target is out of scan plane. No bar indicates that the ultrasound image and the target are in the same plane. You can also activate color or MFI while you are in fusion mode. If you want to perform contrast enhanced ultrasound to get more diagnostic information, then you can activate contrast by going to 2D tab. This will give you access to contrast timer, side-by-side contrast mode, and all the other relevant controls.
After you achieve fusion, you can outline the 3D contour to help visualize the target using tumor contour. The lesion can be rendered in 3D or 2D and overlaid on the live ultrasound or CT images. As you can see, this helps in visualization the location of lesion in relation to the surrounding critical structures. So to summarize, the benefits of fusion and navigation for abdominal application are as follows. It can help in advanced visualization of enhanced diagnostic confidence. You can compare the lesions through multimodalities. You can monitor the lesion progression. It helps to reduce the radiation exposure and contributes in more efficient use of resources. Philips autoregistration demonstrates the evolution of fusion imaging, bringing new levels of simplicity even in the most complex procedures. Thank you for your attention.